Away Facebook Live. I'm very pleased to be joined by, firstly, Georgie Freeman, who's our basically in charge of 5K Your Way. So lots of you might have had emails from her. Now you can see her in person and learn a little bit more about her.
Hi, thanks for having
me. Also joined by two incredible doctors, Jenny Wilson, who is a GP in Bedford, and Liz Riordan, who is a retired consultant breast surgeon. So they're both very inspiring. They're both passionate advocates for 5K Your Way. Jenny is a runner, and I think you had breast cancer about 10 years ago, is that right, Jenny?
2008.
2008, and she's actually, now I have to get this phrase right, what is she? Health Watch Bedford Borough's hero at the moment. I'm not quite sure what that's for, but congratulations. And Liz is, as I said, a retired consultant breast surgeon. She's written an incredible book, The Complete Guide to Breast Cancer, How to Feel Empowered and Take Control. Liz founded the Berry 5K Your Way group earlier this year. She's a speaker, she's a broadcaster, she's had breast cancer, and she's dabbled in triathlon. So Liz, why don't you tell people how I first met you?
So I was a cycling widow. I did no sport at school. I did everything I could to avoid it. And my husband started cycling, and I thought, if I don't cycle, I will never see him. And I got dragged around the Ride 100 in a year's time. But I got bored, and I wanted something for me. And I'd done a bit of running. I'd done the London Marathon. I used to swim. So I started reading every book I could find about triathlon. And in my head, I was doing Ironman, but I hadn't done anything. And my husband got me drunk when we were flying to see my brother in Switzerland and signed me up to do the London Olympic distance triathlon before my 40th birthday. And I was hooked. And less than a year later, I got breast cancer. That was in 2015. And I thought, I want to carry on training. I don't want to lose everything from cancer. And I did a sprint try during chemo. And then I found my cycling coach said, right, I want to do a half Ironman the year after I finish treatment, very slowly, just to prove I can. And it was the hottest day of the year. And it was it Sheffield? No, where was it, Lucy? Stafford, that's it. It was about 30 degrees. And I hate the colour pink. And I'm a breast surgeon, so I'm in the wrong job. But I wore a pink tutu and a big pink neon wig. And I got pink socks. And I ran around and I did it. And I didn't realise that Lucy was giving out the medals. And my coach, who knew Lucy, said, will you stay and give Liz the medal? And there's this crazy photo of me, pink and sweaty fluorescent, with tiny Lucy, who's really small in real life. And we've been friends ever since.
Yes, it's because we've been talking a little bit on Twitter, haven't we, about exercise and cancer and aspirations that we had, and it's quite cool how things pan out. And as you say, we've become friends. So I guess before we get started, I just want to do a little bit of reflection, and it feels, I guess, to a lot of people that the world's getting back to normal. And I was running home from work, and there were people in big groups, and the sun was shining, and the ice cream man was out. And I don't know. I'm struggling. I'm finding work hard on lots of levels, and I guess it just got me reflecting a little bit on what it must be like for those of you who've got cancer, who are shielding at the moment, who are perhaps having treatment without your loved ones joining you, having very difficult conversations with the people you're working with over the phone. And I guess it was just a bit of reflection that, life is getting back to normal for a lot of us, but probably not for everyone. And I wonder whether perhaps this might actually be one of the most challenging parts of the COVID crisis for people with cancer. Because the world is moving on, but actually you might still be having to shield, and hospitals certainly aren't getting back to normal anytime soon. I don't know whether you guys have thoughts on that. It was just a reflection running home.
Well, certainly in general practice, it's very, very different. We're working completely differently now with lots of telephone stuff. I actually succeeded in a video consultation yesterday, diagnosed quite an unusual rash. So we're really pleased with that, but we're well aware that we're awaiting a tsunami of things that people are scared. They're I mean, I work with some people with cancer, but I work with people with whatever problems they've got. And we're aware that people are putting off their lung problems, they're putting off their heart problems. I was speaking with a friend who's a surgeon the other day, saying that her whole of her list was cancer diagnoses last week. Excuse me, my husband's just walked in to fiddle with the router. It's very, very different. And we're aware that people are just really frightened to go out. Well, there's two groups. There's people who want everything to be back to normal and will not socially distance. And there's the other group who, you know, even though they might have something life-threatening, had somebody last week with a possible blood clot who didn't want to go to the hospital in case they got COVID. And I had to be straight and honest and say, actually, you might die of that. So yes, it is very, very different. But I'm well aware for the cancer patients, it's particularly difficult because it's such a prolonged process. And yeah, people don't necessarily understand, family don't understand what it feels like.
No, and I know some of my young patients, you know, originally when it was going on, that in some ways it took out the FOMO that you have when you're going through cancer treatment. No one can do anything, so you're not missing out on anything. And I just wonder whether, and Liz, you probably have more personal relationships.
Yeah, I mean, I am so lucky that I was diagnosed 5 years and 2 years ago, because I could have every single treatment I needed. So many people aren't getting access to trials or chemo or drugs, or they're having shortened courses of treatment because of the fear of COVID. And I got to get all my results with my husband next to me in a clinic. It's not over the phone without that support. And that kind of came home to me. My husband had the virus and he ended up going to hospital for 3 days with pneumonia. And I dropped him off at A&E thinking he needed antibiotics, and they said, we're keeping him in. And I thought, I might never see him again. I can't visit him and he's alone. And that sudden reality of going through this by yourself without contact must be horrific for anybody. It is so hard. You can't imagine it unless you've been there. And I think the general public don't know anyone who's had COVID. They don't get how bad it is. It's not happening. We're all back to normal. The sun's out, but actually there are still young and fit people dying. It's this really weird dichotomy of what's right and what do you do.
And I think from we're struggling. We're trying to keep this community, but you can only do so much virtually. And all the normal stuff is the normal group support that we can offer our patients is gone.
I think that is part of that group support, isn't it? Because we're even the government's encouraging us to exercise, but it's all exercising on your own. And yet parkrun and 5K your way, it's all about exercising together and benefiting not just from the exercise, but the emotional side that goes with it, and the community side of it as well. And it's not. And
it's easier to. Yeah. It's easy to turn up if someone else is expecting you.
Yeah. To get out the door in the first place as well.
Exactly.
So both of you. So there are two things two main things that I'd really like to pick your brains on. We'll do it the other way around to what I suggested, because you kind of got onto it. So both of you are advocates, massive advocates for exercise for people living with and after cancer. And you both got involved with 5K Your Way for your own reasons. And I wanted to talk a little bit about why exercise was important to you, or has become important to you, and why you think it's so important we tell our patients about it. And then also perhaps discuss how we get other healthcare professionals to talk to patients about it and what are the challenges. Because I know even, my background, I sometimes feel that if I tell my patients that exercise is good, that whoever's with me in clinic just rolls their eyes and goes, yeah, you were a professional triathlete, of course you're going to say that. So I'm sold on it, but I don't know how best to talk about it. So so Liz, why is exercise important to you?
For me, and I had chemotherapy, exercise was my form of mindfulness. When I was out cycling or running or walking, I forgot I had cancer. and I wanted to keep my body strong for whatever would happen in the future. And I felt lucky to have 2 arms and 2 legs that worked, because not many people didn't. And it was just my way of getting out and forgetting everything else. And I would walk with a neighbor every morning for an hour. It's the best piece of advice someone gave me, was to go and walk for half an hour every day. It's the best cure for fatigue, and it's the last thing you want to do, but it does work. And we just natter and not talk. And I just love that feeling of getting stronger and seeing my body come back to normal, and knowing that cancer didn't take everything from me. But I now know there is so much evidence showing that exercise can reduce the risk of recurrence. It can reduce the risk of, it improves fatigue, it improves the side effects of chemo, it gets you out of hospital quicker. It should be the 4th treatment. And it's not just aerobic exercise, it's weight training as well. But no one tells you to do it. No one told me to exercise. I lied to my doctors when I said I was swimming, and said, don't swim, it's dangerous, and you can't run for 4 months because your implant might end up underneath your collarbone. So I lied to them because I thought they'd tell me off. Nobody told me to exercise. And I think if your doctors and nurses don't exercise, they don't get how good it can make you feel and how important it is. And when you look like you're a tall, slim, sporty person, oh, it's easy for you, because the treatments make me put on weight and I can't do it. And it's really, really hard. But I really believe we need to educate medical students upwards that it should be the 4th treatment. And if every single person mentions it, it might start to sink in.
And when do you think we should be mentioning it? Because
from diagnosis, maybe even before. But I think if you say, right, we think you've got cancer, we know that if you exercise, it will reduce the risk of infection, it will get you out of hospital quicker after your operation, it will reduce side effects, it will reduce the risk of recurrence. It's hard, but we can prove it will do a benefit. Let us show you how, with either the 5K Your Way, or there are exercise programs in gyms or communities. This is something you can do to take control back. And it's not doctors and nurses doing stuff to you. This is something you can actually do to bring your family on board. And it's giving that power back to the patient. But people don't like exercise because it's a dirty word and it sounds like hard work. And I've got cancer, and you're telling me I can't eat cake and I should lose weight and go running. F off. I want to wallow in misery. Thank you very much. It's really hard.
I find it really challenging. And I guess, off the cancer topic, but with COVID, so my mum and my dad, obviously with COVID, we think that the fitter you are, if you get it, the more likely you are to come out the other side of it well.
Yeah.
And talking to my mum has been amazing. She's got on a bike, she's cycling 15 miles last week. She's fitter than she's ever been. And Dad, with the same attempted motivational talking, as he's doing a bit of gardening, but he's not been out on the bike, despite me literally sending him bike bits and pedals, and and it's really hard, isn't it? I don't know how to get through, and it's something I really struggle with as a doctor, even being completely sold on the benefits.
Yeah, I think for me it's something that started long before that. At school, I have no hand eye coordination at all, so I was always, last to be picked for any sports team.
Me too.
And I remember, I don't know how old I was, about 15 maybe, arguing with the games teacher about something and being sent as punishment cross-country running with boys.
Sounds like me.
And actually, I really enjoyed it, and said, "Can I go back next week?" Which, it was a bit unfortunate, because there are generations of girls that have cursed me since, I think, because that was when cross-country running started in the school. But actually, I've realised right from early on, I've suffered and struggled with depression at various stages. And exercise, running, not big running at all. I mean, I hadn't run more than 5K until after the cancer. But just actually to get outside, run out the front door as a junior doctor, when I was working horrendous hours that we did in those days, which shows particularly my age. Just being able to escape out of the hospital on the mornings before I went in to do a whole, 36 hours on call, was my way. And so I've done that on and off through time. And then I suppose it really hit me when my mum was 80, which is quite some time ago, was before the cancer. And she was struggling with balance, struggling with her chest and so on. And somebody said, "You should join a gym." And she did it. And then she gave
at
me
80.
a pass at 80, yeah.
Oh.
And she gave me a pass to go and try it. So I thought, I suppose I'd better really, hadn't I? And that's when I actually found that I really enjoy weights. So I think it is, yeah, as a GP, it's not just the patients who already have cancer, but it's actually getting that movement, finding what you enjoy as exercise into life, right from school, on from school, through uni, when balancing the alcohol with the exercise to negate some of the effects and so on. That's the crucial thing to get, so that by the time if we do get to having cancer, then actually part of it is ingrained. So when I was diagnosed, 12 years ago, no idea about exercise and cancer at all. And they looked at me very strangely when I said, well, isn't it logical that doing weights is actually going to help prevent lymphedema rather than causing it? And they were, ooh, are you sure? I said, well, I'm doing it anyway. So it's finding what we enjoy. It's getting as a GP, promoting that physical activity right from an early stage, even pre-cancer. And maybe, of course, some of it will be prevented, but certainly would help those with it to get through it.
Georgie, so I'm just thinking back to that phone call we had when you so Georgie and I, just to put it in context, we met at a swim run race, which are these crazy things where you swim and run around the Scilly Islands last summer. And then Georgie went off travelling, and out of the blue in November, December, I get a message from her saying, I'm back. I'd love to help out with 5K your way. I'm not got anything to do at the moment. Can I volunteer? And we had a chat, and just tell people why you wanted to get involved.
Yeah, so Lucy told me about 5K your way very briefly when we were in the Scilly Isles, and then I was traveling. I kind of had completely forgotten about it pretty much and was just having a great time. I came back early because my grandma was diagnosed with liver cancer, which was a massive shock. She didn't drink hardly at all. She was 77, she was completely fine. And so I came back and, just wanted to spend time with my family. And then I was kind of thinking about it again, and I saw a post on Lucy's Facebook about 5K away. And I thought, wow, this is interesting. No one's at the hospital has told my grandma that she needs to, exercise. And normally she would walk 2 miles every day with my granddad. Like she was fit and healthy and fine. And I thought, oh, I didn't really realize you should exercise with cancer. I was the person that thought that they should sit and be wrapped in cotton wool, and so I started like looking it up and everything, and I said to my mum, oh well, maybe actually we need to get her walking around and everything, because she was just so tired and resting all the time. So yeah, I then phoned Lucy and asked if there was anything I could do to help, and started kind of helping volunteer wise. And then luckily it was really great timing for me. I needed a job and Lucy needed someone to kind of fill it. And I've done sport jobs in the past, and this kind of just became something that was really important to me as well. And I really wanted to get her to come to one of the groups, but she was too ill, and 2 months later she died. Which, like, on a side note, is something I think we've kind of not really talked about in these Q&As is about like loss, and about kind of a lot of it is about journeys and people going through chemotherapy and getting treatment, a lot about treatment. And I think for me, like, I don't know that journey. I just know that she was diagnosed and then 2 months later she died. Like there was no journey. So it's interesting for me to listen to you all and kind of hear about everyone else's journey, everyone else, getting involved in exercise. And it's great. It's fantastic because, I saw kind of firsthand that she was obviously, everyone was really sad, but actually she was the one that wasn't really sad. Everyone else was sad. And I know a lot of people will maybe relate to that. But for me, 5K away was just a way to kind of, yeah, give something back, I guess. And I'm really enjoying it so far. I'd love to come to one of the groups.
Yeah, Georgie hasn't yet been to a group.
It was traveling, and then I came back, and then they were cancelled. So
we'll let you off.
But actually, support of relatives is so crucial, isn't it? Because certainly my husband's not a medic, and he found it really hard coping with me with cancer. And one of my sisters got diagnosed at one stage, and I found it harder coping with her and her situation than I did me. And I'm just aware of one of the members of our group who hasn't had cancer, but actually was living through, so his mum never came to the group, a bit like your grandma, but actually he's benefited hugely from being able to talk to other people going through. So 5K away isn't just for those who actually have cancer, but it's for the families, the relatives, the friends, and so on as well. And I'm not sure how many in our group, but we're certainly not 100% have had cancer. We're at least a quarter, if not more than that, who haven't, but are there just supporting.
Yeah, and I think this is definitely something we should discuss on another show, because it's I often think as an oncologist it's often much harder watching someone you love go through treatment than it is going through it yourself. And I think, right now it must be really tough. Honestly, I can't imagine what it's like to be the relative of someone going through cancer treatment. So I think we should definitely talk about that in another show. Just going back to what you said, Georgie, it made me smile because I remember smiling when you phoned me. And I was smiling partly because it made me realise that the impact of social media can be more than just coming down to a group. But also because, you're talking about your granny just needed to be given permission to exercise and to be, not even to exercise, to be active. And your reaction is what we see so commonly, isn't it? That people want to wrap their loved ones in cotton wool and protect them.
Yeah. And then when she did actually, go for a tiny walk outside, like she was grinning ear to ear and, loved it, could literally just go around the garden, but that was what she could do and she was happy with it. So that was nice.
And I think I mentioned this before in these shows, but just to anyone who's shielding at the moment, I cannot say this strongly enough. Please talk to your oncologist or whoever's looking after you about how they think you should interpret that advice, because it's different for everybody. And some people, talk to whoever is treating your cancer about what they would recommend. Ollie, so it seems like we're obviously all behind exercise, physical activity, moving with cancer, but it's hard, isn't it, talking to people about it. It's interesting to hear what you say, Liz, about when we should bring this up. You say right at the beginning. I sometimes wonder that people are overloaded right at the beginning of their journey.
Yeah, I think, as a doctor, we have to give people so much information. We have to say you have cancer, which they may not be expecting. We have to go through all the lists of treatments, all the pre-assessments. You go meet all these people. And I now realize you take none of it in. Yeah. I knew the information I was being given because it's what I gave my patients. I'm a breast surgeon, I got breast cancer, but I still was going, oh my God, I've got cancer. But if every single person mentions it, and you might be given a leaflet to say, right, when you've calmed down, look at this. If every single person says it, you don't need a lot of detail, but just to say, this is important, this is where you can go when you're ready, it will sink in. Because we know you can do so much good. Is it a study with men with lung cancer? If they were on exercise bikes in the 2 weeks before their operation, and they got out of hospital quicker. From diagnosis, yeah. Exactly. I think it's giving them some form of control. Your world is upside down. We are doing stuff to you, but you can exercise and that will help the outcome. That is something you can do.
So just the study you mentioned, it's quite interesting. So they had, and I'm simplifying it a bit, but they had 2 groups of patients with lung cancer. And they got one group to exercise. I'm not sure whether I can't remember exactly what the exercise was, for 2 weeks. That's it, just for 2 weeks. And the other group just did, normal life. What they measure is how far you can walk in 6 minutes. And the group that exercised for 2 weeks, their 6-minute walk distance improved enormously. I mean, not even enormously actually, but improved significantly. And that change was associated with shorter hospital stay, reduced chest drains, needing for drains, and so there is evidence that.
And they were elderly men. Yeah. They're not young fit people. They're you know.
Yeah, so it's really emphasising, isn't it? It's never too late to start.
And actually, it's quite quick. Changes can happen quite quickly as well.
Yeah. And probably happen quicker and easier at that beginning, because it takes off more exponentially.
Absolutely.
But it's also, isn't it, because there's so much, isn't there, around blame. I remember when I was diagnosed and people were saying, the media was full of, well, if you drink more than a certain amount per week, if you're over a certain weight, well, there's times when I've drank more than my weekly quota. There's plenty of weeks that I haven't had anything, and the weight, yes, I'd gone up to a BMI of 28, 29 after baby, and so on. But there's so much, isn't there, that trying to find blame, and I think both myself and my sister actually found that really disturbing. So at least, even if you haven't been exercising, emphasising that beginning to start moving now will start to counteract that in the same way that it's never too late to stop smoking.
And I think we need joined up thinking. We need the GPs to be reinforcing that message as well. Because there's no point if your consultant says exercise and the GP says, oh, no. It's getting everybody to say, this is something you should do.
But then GPs, we should be encouraging it for all conditions anyway, because there's very little that won't benefit from at least movement, even if it's not sort of, marathon running exercise.
I mean, it's the biggest reason.
That's where the part-run practices come in.
Sorry, I just wanted to ask, where would you say, do you think is the best place to start with it? Do you think you need to go to medical students and go to lectures and start there, or where? Yeah.
So I didn't get any lectures on how to prescribe exercise to healthy people, let alone cancer patients who have got rheumatoid arthritis and diabetes and blood pressure. Doctors are not experts. No. It's giving healthcare professionals sites or information to say this is what they can do. So ideally, every cancer patient would see a physio or a personal trainer who has that knowledge to tell them what to do. Because we're not experts, and actually I'm too busy, Lucy, we're too busy telling them about the actual medical aspects of care and the things we're going to do that might kill them. But if you could say, you need to do it, here are community programs, gym programs, exercise programs, tell doctors where to send patients to. They don't have the time, and most doctors won't care about how to tell exercise because I'm so busy looking after the latest trials and guidelines of treating my illnesses. It's knowing where you can signpost people, but I think going back to medical school and hammering it home then would really help.
Yes,
I agree.
It is beginning. I mean, I work with medical students as well, so certainly I will bring that into some of my teaching sessions, just plodding away at it. But within general practice as well, there's much more emphasis now. I'm just trying to think of the word I'm looking for, but on community prescribing, thinking holistically about the patient, about exercise, about diet, about work situations, and so on. So it's beginning, but it's still early days, and I find it quite distressing when I'm seen as fanatic. Actually,
you are.
I shouldn't be fanatic. I should be. What I believe about movement and exercise should be commonplace amongst GPs.
And oncologists and every healthcare professional, whatever their background. Liz, I'd love to explore a bit about just thinking about medical school. And one of the things I'm really struggling with at the moment is communicating with my patients, either over the telephone, standing behind a mask 2 meters away, a video call that doesn't work and breaks up. I hate it. It's making me almost not enjoy work. And I think all the lessons I've learned along the way about how to communicate, you're suddenly that's all taken
so relevant.
And you've got to find your own way through it. So I'm sure as a consultant surgeon before cancer, I'm sure you were a very good surgeon. I'm sure you felt that you communicated very well with your patients. And I know I've read, we've talked a bit about it, and I've read a lot of the stuff that you've written. What are the biggest things that you would change about your pre-cancer surgeon, having gone through it yourself?
So one thing I did change was the language, because when I tell 10 women a day they have cancer, it becomes normal. I'm not shocked. It's just another woman with cancer, run of the mill. And you may see one woman a month that really makes you upset, but it's just another woman with breast cancer, because that's my job. And then when you hear those words, it is life-changing, earth-shattering. You're suddenly aware that you might die. Oh my God, it's real. And I suddenly got how bad a cancer diagnosis can be. And I've told patients, it's just a little bit of DCIS, so it's a small cancer, don't worry, it's nothing to worry about. But to that person, it's cancer. And I think every person breaking bad news needs to realize this is a huge momentous occasion, and they will remember every single detail of that conversation for the rest of their life, because it is life-changing, even though it's normal for us. And the woman I see at the end of the day doesn't get the best of me. So I think just remember, don't belittle it. Don't tell them it's just a bit of this, because to that person, it's not. I also think doctors, well, I am very bad at butting. I don't like silence. I like filling the gap. And I've realized as a doctor, I know what I'm going to tell them. I know I'm going to tell them they've got cancer. I know what treatment I'm going to tell them. The patient has no idea what's coming. And I think it's telling them they've got cancer and then physically making myself count, sometimes up to 10. And giving them space to think. And then often it's the first question that comes out their mind that they're really worried about. And if you rush in, they don't have time to say, well, who will look after my horse? Or am I going to die tomorrow? Because we butt in. And then the final thing is that consultation is about the patient. It's not about me telling them. And almost before I start, I say, right, what questions do you have? Because I've gone into consultations and I've waited for an hour in the clinic and I've got my list. And by the time I get in there, I can't be bothered to say it. I don't want to hassle them. I just won't ask. And then you go away crying because you've not got the answers. Because the last thing we say is, have you got any questions? When you close the screen, it's so
standing up, walking out the door.
Yeah, exactly. Yeah. And I think actually, before I start, what do you want to ask me? And then move on. Does that kind of help?
Yeah, I think it's.
But over the phone, it's impossible because you don't have that body language. There are no verbal cues. You don't know whether they're alone. Are they breaking down? I'm just so glad I'm not doing it now.
And the silences over the phone are very awkward.
Yes.
Well, they can be very awkward. I mean, what's it like? What was it like being a breast cancer surgeon and being told that you've had cancer? How do you deal with that knowledge and just everything?
So they did, my mammogram was normal. They did an ultrasound and I saw the screen and I knew it was a cancer because I do ultrasounds myself. I told my husband, they'll be telling me in a week I have cancer. No, they won't. No, they will, believe me. And I told him if the breast care nurse comes to call us through, then it's cancer, because when it's not, they don't. And she did. And he said, no, you'll be fine. And I was treated by colleagues who were all in tears, and my husband was in tears. But for me, I was like up here looking down. It wasn't real. And I think I'd seen the worst case scenarios. It was my way of protecting myself. But I realized I know nothing about breast cancer. I can tell people what's going to happen to them, but I don't know how to cope. I didn't realize you lost all your body hair during chemo. I asked someone, will my hair will fall out? And she said, well, your pubes will come out in day 10. And I went, what? I thought you just lost the hair in your head. I knew nothing. I didn't know what bras to buy or how to cope with sickness. And I think we are very bad at telling people how to cope. And that's where patients, like the WhatsApp group I started, how I met Jenny, they're the guys who told me how to cope, what to drink, what to eat. They're the people who've got me through, not my doctors.
Jenny, do you have any thoughts from your experience?
Yes, I mean, again, so much goes on the experience we have, doesn't it? So for me, obviously, I see breast cancers at a very different stage from Liz. So I often see a lady with a lump. So I don't know. And actually, in terms of the numbers of breast lumps I see, it probably isn't breast cancer. Some of them you can tell blatantly, obviously it is, but actually remarkably few, and you can be wrong both ways round. so it's that talking, and I suppose the way I've changed is that I will now, because I'm still seeing these ladies, but of course it's not 100% of my work by any means, I will actually share in appropriate cases just a very little of my story, just to really reassure them and show that I'm willing to, you know, they can come back and ask me questions. But for me, my diagnosis, and mine wasn't visible on a mammogram, wasn't visible on an ultrasound. I ended up with this ridiculous procedure of having a needle stuck in what they thought might be something, but they weren't sure, and then having to walk all the way around the X-ray department to have this needle mammograms. That was mighty horrible as an experience, and then waiting forever for results. But I was just remembering, well, as a GP, the only breast cancer I see, ladies die of it. And that's because the vast majority of patients actually don't end up coming back to the GP. Many of them are diagnosed on the mammography, the routine mammography. They never come anywhere near us because they've been invited by whoever does the inviting, and then they go through the process and so on. They never come back to us. So it's really only a few of the ladies that I see with lumps, and then many of them don't come back either. So I was just looking after those who had secondary cancer, who were palliative and so on. And so I was convinced, because of my personal experience, that all ladies died of it. And yeah, so therefore my instant thought was, help, I'm going to die, which at 45 is not good. But I think the thing I particularly learned is that we are all individual, and like Liz says, you don't know about the personal experiences, but also I have no idea, which Liz does know, is that every breast cancer is different. So there's all sorts of different histologies, there's all sorts of different stories and the way it's treated. Yeah, I'd never heard of lobular breast cancer. I didn't know what that was until they told me that that's what it was and why I needed an MRI to diagnose it properly. Yeah, so I think it's, yeah, for me, it's the individualness of it, but letting the patient talk through and approach it as they want to.
Something that I always, I guess one of the things that I'm most scared of, were I to get cancer, was being pitied by people, pitied by friends, and perhaps even more so, walking around the hospital, seeing colleagues, imagining them all talk about me. Oh, isn't it awful? Lucy's got cancer. Liz, was that a big, you know?
Yeah. So I was treated not in my own hospital, not because I didn't want to go there, but because I didn't want my team to be talking about me in an MDT if it was something bad. So I was treated in a hospital where I'd worked as a junior and senior doctor, where my husband was a consultant surgeon. Everybody knew me. And I remember sitting in the clinic waiting to go in, and the breast care nurses who I'd worked with came up to me and said, "Hi, what are you here for?" "I think I've got cancer. How are you?" It's really hard when you see someone you recognize. And then they said, "Do you want to use a different name so people won't hear your name when they called out?" And the only thing that went through my head was to use my porn star name. I think it's the name of your mother's maiden name and your first dog. But I thought I won't remember that. Mine's Max Love, by the way, a dog my mother's maiden name.
Good name.
It's a very good name. But it was just suddenly, people are going to know I had chemo first, and it was that I can't not tweet about this. I can't keep it silent. So I made the decision to come out, and I told Twitter the next day so people knew, so they wouldn't talk about me behind my back, because it would be obvious I was having chemo. But it was really hard for people who'd worked with me to have that pity. And when you're going into the operating theatre with people you've worked with and they say, "Hi, how are you? What are you having done today?" And I'm bold saying, "I'm going to have my breast cut off. What are you doing?" It's really, really hard. And I think if you are a healthcare professional and you recognize someone that you know in a patient environment, you don't say anything. Unless you go out drinking with them regularly and you talk to them all the time, they're not your friend. They are there as a patient. Because the minute someone comes up to you and says, "Oh, hi, Lucy, why are you in the colorectal clinic?" They've broken your patient confidentiality. They're almost forcing you to tell them what's going on. And I would now just make a nod of the head and walk by. And if they want to come and talk to me later, then that's fine. But it's almost you don't know that person. It's really, really hard. And I treated colleagues all the while. I mean, breast cancer is a female disease. There are so many women in hospital, and it's really hard giving them that privacy and treating them like a normal patient. But that shame and that, oh God, they all know, they all feel sorry, the touch on the shoulder. But most people were lovely. And what was really funny was, sorry, I'm talking a lot. The night of my mastectomy, I was high as a kite on morphine. I think I knitted a scarf all night. I couldn't sleep. And a trail of nurses came and sat with me to say, I've had cancer too, and I can't talk to anyone about it because I don't want them to know, but I can talk to you because people know you've had it. And that was really, really nice. But I just felt we don't support our own profession. So many people in the hospital will have cancer, but where do you go to talk about your symptoms or problems you might be having? I think that's something we could do to support each other.
Yeah. And that's what you've done with the WhatsApp group to some extent, haven't you?
Yes, yeah. Because we are all different. So I know that I had a colleague at work who was diagnosed very shortly after me. But I was really open and I told everybody, and you know, because I don't want them to be frightened of talking to me because they don't know what to say. Whereas she, and so I just, you know, I like colour, so I decided I'd go for scarves rather than a wig and so on. And I had my chemo first. Whereas she wouldn't tell anyone her wig was precisely the same as her hairstyle. And everything was so that people wouldn't know. And my impression, obviously I'm not her, I can't say. My impression was she found it much harder than I did. So, but we are all very individual in how we cope. And I think that's something in the group that we've noticed as well, isn't it? That some things that will upset one of us, one of the others wouldn't give a toss about. And and that in terms of communication, it's a really difficult judgment.
And it's really hard as a doctor to know what is going to matter to patients. And talk about hair loss, for some patients it's the end of the world. Other patients just don't, it's the least of their worries. I guess one of the things that I hope we can get from the 5K Your Way groups is getting a group of people living actively despite a cancer diagnosis, and just normalizing being, living an active life. And I guess just knowing that there are people around who get it and who will talk about, who are there if you need them, but actually you're just going to get on and have a nice Saturday morning and probably not talk about it at all.
And certainly recognising with medical colleagues, because I also, as an older GP now, tend to have a lot of other doctors that will come and see me, and it's recognising that actually we come from different specialties, and so we can't know everything about everything, and it's how do you pitch that without belittling. So I remember when I was first diagnosed, and the oncologist was giving me, he was doing the give her choice bit. So he gave me choice by bombarding me with medical trials. And in the end, I just stopped him and said, I'm just a hormonal woman at the moment. Tell me, if I was your wife, which would you choose? And he just came out with it. And that's what I went with. Because we do all communicate differently. And he got scared. She's a GP, so I've got to keep it scientific. And that wasn't the case at all for me.
So I can relate to that a little tiny bit, and I think it's changed me as a doctor. So when I was for those of you who don't know, I was a professional triathlete for a bit, and 8 weeks.
She wasn't very good.
8 weeks before the World Championships, I broke my collarbone, and I was going back to work 2 weeks after the World Championships. It was my last. I knew it was the last World Championships, and I fell off my bike, broke the collarbone. I went to see a surgeon a couple of days later, and he gave me all the information about whether or not I should have it fixed. And he was a really good communicator, and he told me everything that I needed to know. And he said, well, you won't be able to race if I don't fix it. You probably won't be able to race if I do fix it. You might rip the plate out. You might get an infection. You don't need it fixing. The only reason to fix it is to give you a small chance that you might be able to race. And he went on and on. He's a lovely guy. And I just, you're the surgeon. I want you to tell me what to do. And I until that point, I'd always thought that my job was to give patients information to make the decisions for themselves. and that has changed. And I know for some patients that's what they want, but for others, they want to be given the information, but they actually want the expert, in inverted commas, to make the decision for them. And it's so, it really is probably one of the most useful learnings from my triathlon career.
I think, so I had this, when women need a mastectomy, you kind of think that you have to, every single woman has to be offered every single reconstruction choice, and you could spend hours going into it. And I worked with an amazing woman who said, I just mention mastectomy and go by their face. And if they look horrified, I'll go down the reconstruction route. But if they kind of accept the standard, I think it's, patients are coming to terms with the fact they've got cancer. If we don't know what to do, how are they meant to know? And I think it is hard. We can play by the book too much.
Yeah.
Because it's normal to us. They're still thinking, holy shit, do I want chemo? I don't know what this involves. Whereas to you, it's just a bit of chemo because you're not the one living with it.
Yeah. I don't think it is just, I dispute, I hope it's not just a bit of chemo. I've
heard people say that in MDTs, and I think, no, it's not. This is not, you know, it's a tiny benefit. Let's give it.
Yeah.
It's not just a bit of chemo. Yeah.
I like to think that there are doctors who don't just think that, but yeah. We normalise. Georgie, have you got...
I was just going to say, Lucy, that just reminded me exactly of what you were talking about on the podcast with Luke. So if anyone else has listened to it that's listening, and other things
just maybe just explain what the podcast is.
Yeah,
I've never been grilled much on a podcast.
He's really good at kind of digging right in, isn't he? And I've listened to all of them now, and so Luke Grenfellshaw, who's cycling from he was cycling from Bristol to Beijing, supporting 5K Away and supporting other cancer charities. He's now doing a podcast called Facing Up. I've done a few posts about it, and I'll do another one after this. And Lucy was his guest, and Gemma's just been his guest as well. So listen to both of those, and I think he's brilliant at kind of getting information out of who he's talking to and delving deep in. But it was just making me realize that we've been talking about a lot of things that he discusses on those podcasts, like Lucy saying about, you know, the kind of you wanting the surgeon to tell you what to do, whereas you obviously didn't think that you were going to be that type of patient, and the patient and the doctor relationship was really interesting. And then other things like you were all saying about how you would, you know, you wouldn't want to kind of be looked on like, oh, you know, she's got cancer, poor her. Like he was saying about how he'd made friends post having cancer, with a different podcast with his friend called Jeremy, and that was really interesting, like how he wanted people to speak to him, but he then also said, you know, different people would want to be spoken to differently. Anyway, I just wanted to say I really recommend from this conversation. I think that would be if you haven't listened to them yet, definitely go and give them a listen.
And Luke, if you're listening, then maybe you should pin up Liz and Jenny for an interview, because I think you'd put them both in the hot seat. Liz, we're kind of running out of time. Tell us what your crazy next challenge is. I don't know whether to laugh or smile, laugh or cry when I heard this.
In my head, I thought I'm going to do an Ironman. I've done a half, but I realized I don't like running enough to be able to do a marathon quickly enough so I can finish in time. I'm not a natural runner, 5Ks enough. And I realized I wasn't doing any weight training. And the whole point of exercise oncology is the aerobic and the resistance. And as someone with the menopause, with weak bones, having infusions, I thought, right, I need to strengthen my bones. And I love being in the gym. So much so that I'm now doing proper weight training with a crazy goal to enter a bikini competition next year on stage in a tiny bikini and shoe polish with my short curly hair and my flat chest and my non-existent lats and pecs, looking asymmetric, just showing that you can be beautiful even if you look a bit odd. And it's a really scary world. There's a lot of disordered eating and people doing it just to get really, really skinny. And I think this is my way of learning to accept this is who I am and I'm proud of my body. My mum doesn't know yet. She may know now.
She did like one of the tweets, Liz. So
she did. It's just getting strong and getting healthy and protecting my bones because they're crumbling away with an early menopause, and I'm loving it. Well, being the girl in the gym lifting heavy weights, and the men go, "Would you like a hand with that?" It's like, no, I can do it by myself. As well as all the cycling and I'll still always cycle and run.
Yeah, just watch the pelvic floors though. That was one of my.
Oh yes, yeah.
And Jenny, you've got some tattoos, haven't you?
I have, yes. I because of going to the gym and so on, and you know, in female gym changing rooms, you have up to 7-year-old boys in there because they can't be not with their mums. And so actually, after my reconstruction, because I decided I wasn't going to have NHS tattooed nipples, I would go. So I've actually got butterflies across my chest now.
That's brilliant.
So yeah, hats off to you, Liz. I think normalising body changes is really important. You're probably the only person that I'll let off going in a bikini competition.
Thank you.
Just looking through some of the comments.
Yeah, I was going to say there's quite a few comments.
So Sophie Gasson, hi Sophie, and Sophie, big thank you. I know you've been amazing over the last few weeks. So yeah, thank you. Sophie says, Liz, I agree. Exercise should be at least mentioned right from diagnosis. It's information which should be shared, not withheld. So I agree. I think we owe it to patients to bring it up. And I know all three of us are, all four of us are trying to change that conversation slowly. Sarah Harris, hello. Eleanor Thompson, hello. Sarah has said we're having a virtual coffee morning on Saturday. You're all welcome to join us because it is, of course, 5K Your Way Saturday this Saturday.
It is.
Right, yeah.
We are doing
times. Gemma, yeah.
Workout with, I need to post about it. Gemma and Rosie, our Brighton and Hove ambassador, is joining her this week. So that's at 9 a.m. on Saturday. I'll do a post about it tomorrow.
Brilliant.
Moving your way. Jodie Jones. So Jodie Jones, I don't know if you're still on, Jodie, I hope you are, but I cannot wait to talk to you. I think you're on in a couple of weeks. So Jodie, I don't know her, but I heard about this incredible lady who swam the channel a year ago on chemotherapy for bowel cancer. Woo. So yeah, Jodie, we're super excited to hear your story. Sarah, hi Sarah, agree. I finished treatment in February, got the shielding letter in March. Fortunately, my GP was super supportive in telling me to continue to run, walk, cycle outside, which is what I'm doing.
Brilliant.
Oh yeah, Jodie was saying great advice on shielding. So I think just going back to that, I really would, anyone who's on treatment, and if you know someone who's shielding, just say to them, have you spoken to your doctor about what this means for you? Sylvia Jones is saying the same. Hi Sylvia, spot on advice about shielding. After your last show, I contacted my oncologist who told me that the letter for me was over the top and that I could and should go out and exercise. So thank you for the prompt.
That's brilliant.
So yeah, this is
as part of the problem with the shielding is that the letters have been either centrally generated, so they don't take into account actually that your chemo finished 6-9 months ago, or they're generated by, we as GPs have been just hunting through notes, trying to work out, should this person shield, shouldn't they, what are the risks, because we're all individuals, we're not all in the same mold, so that's why some letters haven't been appropriate.
And the patients I've had patients who I've spoken to and they've been too scared to ask the question. Never be too scared to ask. So Sarah, again, I'm not a medic, but I'm a biomedical scientist in histopathology. I carried on at work during the time between biopsy and surgery, knowing that my diagnosis had taken place in our lab. Those staff that did know about my diagnosis were fantastic, but it was only when I went off sick for my surgery and treatment that I realised just how hard I'd found it in those early days. Thanks for sharing that, Sarah. Helen Murray saying that's blooming brilliant, Liz. I'm assuming that's
Sarah.
Sarah.
No, it's bonkers.
You have to keep us updated.
Thank you very much for everyone that's been watching. Liz, Jenny, Georgie, any final comments you want to share? Liz first.
I just say, if there are any doctors out there who have cancer, I have a WhatsApp group for Doctors with Cancer just to talk about the issues that affect us particularly. So just contact me either through Facebook or through the group and I can add you to them.
Great, thank you. Jenny, anything you want to add?
Did you want me to read that poem that...
oh yes, that would be lovely.
Oh yeah, I was going to say.
Yes. It's basically one of our group. She's written it, she's part of two groups, so long before 5K Your Way existed, there was a group of us meeting up after Parkrun, and then Vicky was diagnosed with lymphoma. But she wrote this last week when she was challenged by her sisters to write a poem. And she says, Once there was a gathering of like-minded souls, high-vis vests in various roles. We ran past the water, the fountain, the trees, past the man drinking cider, the gaps getting wider between all the athletes, the strong and the young, and the stragglers and plodders. Your song is still sung. You're walking, no matter, you're doing your best. You'll go through the timer with all of the rest. A rainbow of colours, purples and blues, the pounding of 200 running shoes. Once there was the smell of coffee and the sound of the clatter of plates with our toast, the buzz of our chatter while we sit in the sun or the wind or the drizzle. We were strangers at first, we drifted together, cementing our friendship, lasting forever, sharing the fun, the laughter, the sadness, solving world problems, enjoying the madness of the years of Saturday mornings. Once there was a life.
And there will be a life again.
Yes.
There will be. And we will get through this.
You need to add that onto the end of the poem, Lucy.
Yeah, that's beautiful.
It's really beautiful.
Really, really nice. Yeah.
And yeah, I just, to all the ambassadors who are watching, I just want to say a massive thank you. I think this week's been a real eye-opener to us about how tough life is for everybody at the moment, and particularly those of you who are shielding. But there will be life at the end of this, and we are resilient. And 5K will be back, and the sun is shining, and I think we will get through it.
I just wanted to say as well, thanks for the three of you for having me, and sorry if I wasn't so great as Gemma, but I'm learning, and
you've been brilliant. Get rid of Gemma. Get rid of Gemma. We don't need her anymore.
No, don't do that. I also wanted to say as well, if anyone else that's listening, I kind of do all of the kind of background stuff every day. So if you want to get in touch, if you have any suggestions or any comments or questions or anything, please send me an email, info@5kyourway. And we'll post this on the website with all the others as well, so you can catch up whenever too.
Brilliant. Well, thank you very much, everybody. Have a lovely evening, and we'll see you on Saturday for the Move Your Way exercise session.
Yes, 9 a.m.
Brilliant.
Thank you.
Bye.
Bye.